Vamos a estar en compañía de la doctora Akerman. Ella es médica dermatóloga de la Universidad de Tel Aviv y tiene muchísima experiencia con diferentes tecnologías. Hoy ella nos va a estar entonces compartiendo sus resultados con la tecnología iTED, es una tecnología nueva, y vamos a estar enfocándonos en el tratamiento de cicatrices, de estrías y de rejuvenecimiento. Esperamos pues que disfruten.
So, hi everyone, I'm Leavit, I'm from Israel. It's a pleasure being here with you. And in this workshop, I would like to introduce you the legato system, and I want to focus and to point out the advantages of this system in treating all kinds of scars. So, the treatment protocol with the legato system includes two different handpieces, the RF roller handpiece and then the impact ultrasound handpiece. This actually enables us to perform what we call transepidermal delivery procedure. Transepidermal delivery procedures can be performed with any other fractional technologies such as RF technologies, erbium or CO2 fractional lasers. So those procedures have been very popular in recent years since it enables us to insert active substances to the skin. In this procedure, we ablate and perforate the skin using the pixel handpiece, and then we apply active substance on the skin and we push it through the skin using the impact ultrasound handpiece. The RF energy in this machine is a unipolar fractional ablative technology, which means the skin acts as the second electrode which is needed for the RF procedure. The treatment technique involves keeping the RF roller in motion and in loose contact with the skin. This is very, very important in order to achieve good results. If we have a loose contact with the skin, microsparks will be generated and therefore many tiny microchannels will be created and we achieve both ablation and perforation of the skin. Here you can see this is the roller of the RF. These are the pins of the roller of the RF pixel handpiece. You can see that the contact with the skin is very, very loose. And when the RF energy reacts with the microplasma, which is out here, the spark will be generated and the spark will create those microchannels which go all the way from the epidermis until the dermis. Here you can see a crater that is caused by a single RF spike. Okay, you can see the perforation of the epidermis and it reaches the dermis. Here what you can see is full reepithelialization, which occurs as fast as 3 days after the procedure, which means that we have very, very fast healing process. And what you can see here is a new collagen formation, a new rearrangement of the collagen, which happens 14 days after the procedure. So, what are the advantages of the RF compared to other fractional technologies? First of all, we want to compare this RF to other RFs. So, if we want to compare it to, for example, to other RF technologies like RF needling, the procedure is a lot painful when you do the RF needling. This procedure is not painful at all, and we will see at the demonstration later on that this procedure is virtually not painful at all, and this is very important because we want to keep the patient coming over and over again, and if we do something aggressive, something very painful, the patient will not return. Another advantage of the RF that it's blind, it doesn't see color, so because it doesn't target a specific molecule. So it means that it's very safe to work with the RF on even darker skin types, the 4 skin type and even 5. It's not a problem, and we don't have the risk for post-inflammatory hypopigmentation. Now I want to compare the RF fractional technology to other fractional technologies which are out there, which is the erbium and the CO2. So what we can see in this slide, we can see that the erbium is very, very superficial. You almost don't get any dermal effect. You only affect the epidermis. But on the other hand, the CO2 is very aggressive. It's too aggressive. It affects the epidermis, it affects the dermis, which means you have very, very high thermal effect, but what goes along with it is very long downtime. Of course, it's more painful and increased risk for post-inflammatory hypopigmentation. So if I want to conclude and compare the advantages of the microplasma technology, which is the technology in this system, to other fractional lasers, you can see that this procedure is almost not painful at all. The downtime is very, very short. The risk for post-inflammatory hypopigmentation is very low. And another thing, I can control with this new technology exactly how deep I want to go. It's not blind. It's blind for color. But if I do a higher energy, and I'll show you how I control the ablation or the thermal effect, I can make the treatment better for the situation of the patient. Another advantage of this procedure is that the recovery time is very fast, and it's a fast procedure. The time that it takes to make the treatment for the whole face is less than 10 minutes, which my time is very valuable, because when I do treatments on patients, I want treatments that doesn't take very long time, because if it takes a long time, then I'd rather do something else in this time. Okay? Here you can see a patient that I did a fractional CO2 resurfacing. This picture was taken 3 days after the procedure. You can see that the healing process is very, very slow. It will take another 4 days for full recovery of the face, and with the RF technology, the whole healing process takes about 4 days maximum. So, what are the advantages of this technology, which makes it a very good solution for scars for many kinds? I've been working with this machine for a long time, and in the previous version, as I was telling you before, the procedure was a lot more painful, and we weren't able to control very effectively the thermal and the ablative effect. So now in this machine, we are able now to work in very, very low parameters. We can control effectively the thermal or the ablative effect, and we have new tips which makes it possible to work for newer indications. So what are the advantages of this system? Again, it's a fast procedure, it's almost pain-free procedure, and the ability to control the ablative and the thermal effect makes it possible for me as a clinician to give the specific treatment for the exactly problem that the patient has. Here you can see the screen of the machine, of the Legato 2. What you can see here, that we can now work in very, very low parameters, which is an advantage because you can get, some patients are very sensitive, so here you have the possibility to do treatment, to do effective treatment, which is not painful at all. Another advantage of this system is you can choose if you want to get more ablative or more thermal effect according to what you need. We can do this switch between the ablative or the thermal effect due to what we called phase shifter technology. So why do I need to distinguish between thermal and ablative effect? It depends on the problem that my patient have. For example, if I want to treat skin rejuvenation, okay, so usually I have wrinkles, which is in the dermis, and usually I have some sun damage, some dyschromia, which is in the epidermis. So I want both epidermal reaction, epidermal effect, and dermal effect. So I want both thermal and ablative effect. But if I have, on the other hand, a young patient with acne scars, her skin is young, she doesn't have anything, I don't need to treat anything in the epidermis, I want to treat deep. I want to treat the acne scars which are situated deep down in the dermis. So I want to have a more thermal effect. But on the other hand, if I just want to do a very, very superficial peeling, I don't want to go deep, I will do an ablative procedure. We can also use the various tips for various indications. For example, if I want to do, again, very, very superficial procedure, I will use this tip. This tip has 15 pins per row, which means that the energy that is generated in every pin is very, very low, which means we'll get very superficial procedure. Okay, we'll have more ablative than thermal effect. This we use mainly for very superficial peeling, like a superficial chemical peel. Usually it does it does like superficial skin rejuvenation. It's good for sun damage. It's good for younger patients, which you want to do a very superficial procedure. The downtime in this procedure is not longer than a day or two, because we go very superficial. And this is the protocol, the suggested protocol. Of course, you can go, this is only the baseline, this protocol, you can adjust it after you get some experience with the system, you can change it according to what you see good. So you can see that the energy that we are using for this kind of procedure is around 30 watts. We are doing it in the more ablative regions, and the number of passes is between 2 to 3. I usually don't count the number of passes because I look at the skin and I see the reaction of the skin. So, but the number of passes is usually not less than 2 to 3 passes. On the other hand, I have the aggressive tip. This roller has 3 pins per row, which means every pin generates a lot of energy, a lot of RF energy, which means it goes deeper. And why do I need it? Usually I can use it for traumatic scars, for burns, for hypertrophic scars. In this kind of scars, I want to treat the epidermis because I want to treat the edges of the scar, and I want to reach deep down to the scar. So I want to achieve thermal effect and ablative effect. So what I'm going to do in this kind of scars, I'm going to do 1 or 2 passes in the thermal zone and another 2 passes in the more ablative zone. So I combine the treatment that I need, which will give me a better result for the problem that I'm treating. And here you can see a typical acne scars, the box scar or the rolling scars. And for this, we usually use the 6 pins roller, and you can choose if you want to be more ablative or more thermal. Usually for acne scars, if you don't have any melasma or any pigmentary dyschromia, you need to be more ablative than thermal. You need to be more thermal than ablative. So in conclusion, what I've been trying to tell you in the last minutes is that every scar is different. You can't compare stretch marks to hypertrophic scars to acne scars. The pathogenesis is a little bit different, the clinical picture is a lot different, and you can't treat all the scars the same way. This way, in this system, in the legato system, in this RF system, in combination with the various kind of tips, you can give each scar a specific treatment which will result in a better clinical improvement of the situation. And how do we do it? Because we can control the depth of the procedure, we can control the ablation versus the thermal effect, and we have various kinds of tips which can be used for various indications. So again, those are the tips. I was talking already about them. You can see that the 3 pins tip it has very high ablative effect. The 15 pins tip is very superficial, very low ablative effect, and the 6 pin tip has a medium ablative effect. The last tip, this is the last tip. I rarely use it. It's a stationary one. These are all rollers. You do in motion procedure. This roller is a stationary one. You use it mainly, it's good to use mainly for very, very small scars. So you can see again, for every different scar, you have a specific treatment. As I was telling you before, the RF is not the only player in this procedure. In order to perform transepidermal delivery procedure, we also need the impact ultrasound. So in the beginning, we do fractional ablation with the RF, then we apply active substance on the skin, and we push it into the skin, into the channels, using the impact ultrasound handpiece. And this is what we call transepidermal delivery procedure. And I want to say again, you don't have to use, the fractional ablation can be done with either erbium or CO2, and then you can put the active substance and push it through the skin with the ultrasound. You don't have to do it with a fractional RF. What is the role of the impact ultrasound? What is the mechanism of action? It works as a hammer. It pushes the active substance into the skin. And what you can see here, this is the penetration of ink into pig skin after performing RF procedure. And here you can see a much greater penetration to the skin when we do pixel RF and impact ultrasound together. So it definitely improves the penetration of the active substances. The RF pixel perforation generates microchannels which are 80 to 120 micron in diameter, which means you can actually insert any substance, any active substance that you choose, either cosmetic or pharmacologic, anything, any molecule which is in the field today can be easily inserted and pushed through those tunnels using the impact technology. So, what are the indications for transepidermal delivery procedure? You can use it for scars, for all kinds of scars, for traumatic scars, for surgical scars, for burns, for post-inflammatory hypopigmentation, and of course, you can use it for stretch marks. It gives you also a very good solution for skin rejuvenation, and it can also treat melasma, and I will show you pictures of for all those indications. When you are a young doctor and laser and technologies, new technologies appear every day, new machine, new technologies, you can't really, when you are a young doctor, you can't buy all those machines. So a few years back, when I was still young and I didn't have a lot I couldn't buy a lot of machines. So I was looking for something that is not as expensive on the one hand, but on the other hand, I was looking for something which was much more powerful, a little bit more aggressive than the non-ablative technologies. And this is the exact procedure that, on the one hand, is effective. It's an aggressive procedure, but on the other hand, the recovery time is very, very short. The machine is not expensive, and you can use it for many indications. So it's good for a young doctor, for a doctor who doesn't want to buy a lot of machines in the beginning. And another important thing with this procedure, it's safe. Nothing could go wrong. It's irreversible. And I'll show you some scars from CO2 resurfacing, which is, as I was telling you, is a very aggressive treatment. So it's very important that you do treatments which doesn't have severe side effects, and this is one of those machines. So my experience with the Legato, with this system, I've been working with it for over 2.5 years. I've been treating over 200 patients for those indications. It's important to say that patients like this procedure because it's effective, it's almost not painful at all, and the patient, when you choose the right patients for the right indication and you give them the right treatment, the patients are very, very satisfied. My protocol, the protocol which I use, I usually do, the treatment intervals is usually 4 weeks between each treatment. The number of treatments varies between 1 to 9. The average number of treatments is around 4 sessions per patient. The energy which I'm using is between 30 to 75. Again, the average energy that I'm using is around 40. You usually don't need to get much higher energies than that. And the number of passes is between 4 to 6 double passes. Regarding the formulas or regarding the active substance which you apply on the skin, actually you can apply any active substance which is used either in the cosmetic field or in the dermatological field. Usually I've been using formulas which were made for these procedures, which contain biomimetic peptides, but you can actually look at the indication you are treating and find a substance that will enhance the reaction. For example, if we are treating